Welcome to Creepy Baptist Health Center.
Thank you. That of using the hand with soap and water. Is she part of the boy? Okay. What is the objective of hand hygiene? Why are we cleaning our hands? We are cleaning our hands to remove viruses, bacteria, microorganisms, dirt, diseases, or other harmful and unwanted substances stuck on the hands. So this is every day. This is the environment we find ourselves in. That is the patient. This surface, it can be anything. This surface can still be you. Are we together? I don't want us to limit ourselves on this picture, but we look into it in a different way. This surface that you are seeing here can still be you. How will I say? Let's use dental. When you are going up to dental, you have the staircase. You have this support, these bars. We keep touching it and going up, supporting ourselves and going up. How many people touch that thing today? So many. How many of them leave from the toilet before going up there? How many of them left their home from their toilets? How many of them came to consult, maybe for cough and catarrh, whatsoever? I know how we do it. And then, is that not what we do? That is what we see every day. And then at the end of the day, from the toilet, some of them don't even have that time because of their discomfort, their pain, they don't even want to wash their hands. Some will go in there, they don't even know the use of what is standing there. So they will do what they can do. You know what it means for somebody to come and then work on you, consult you without touching you. You know what a touch means in health. So here is the doctor, here is the nurse, here is the whoever, the healthcare worker. They come to check. We will check, take pulse, we will check, take everything. Are we seeing what is happening? We pick up that infection. Whatever be the thing. It could be virus, it could be bacteria, it could be anything. We pick it up from the patient. Now look at the hands. The hands are already contaminated, right? Okay, so what happened? What happened next? We have patient A, we have patient B. What happened next? Some of us, we are so hardworking, so I said I want to work on two patients. From patient A to patient B. After a serious and a hardworking day, busy day, this is what you will do. You carry the infection from patient A, you give to patient B. They are coming back from the ward. The patients are happy. No, I like this doctor. Anytime we call it so, the job attend for me. That's what the patients will say, right? They're happy. The question is it quantity or quality care? Can we say it out?
Quality.
That is quantity. That is not the quality care we are talking about. You should take note of this. In as much as the hand can be very useful, it can also be very dangerous. All what we have seen above, the hand hygiene be an option to healthcare workers. We answered it from the beginning. Here we are talking on the theme, the healthcare quality and safety climate or culture. When we talk about culture, we are talking about what is part of us, right? Quality care quality and safety climate or a culture that values hand hygiene and infection prevention and control. That is what we are aimed at. I would like us to go into my 5 moments of hand hygiene. I would like us to read together. Number 1.
Before touching a patient.
Before touching a patient. 2.
Before cleaning or aseptic procedure.
3.
After body fluid exposure.
4.
Touching a patient
And 5.
After touching patient surrounding.
So this is the culture we want to build. This is the culture we want to remind ourselves of. We know all these things. We want to just remind ourselves of this culture. This is the culture.
Okay, let's drop. Let's a palm. We start with the tip of the fingers of the right hand. We turn to the right hand and dip the tip of the fingers of the left hand. Rub the palms. We interlace. Go to the other hand. Let's go. Take the other hand. Rub the thumb. Wow. Rub the other thumb. And then you can go anyhow until your entire hands have been sanitized.
Thank you. Can we clap for her?
Then you extra.
Thank you. Okay. I will invite the next person to demonstrate to us how to wash hands. So, but when we leave from here and we go into our various departments, make sure you do it. Are we together? Yes, just take time and practice it. Just take time and practice it. Practice it in such a way that if they give you an exam tomorrow, you will score 20. Is that okay? 100%.
Good morning, colleagues. I'll first go by taking my soap. I'll wet my hands. And then I'll start with my thumb. And then interlace. And then I'll scrub my fingers. And then I'll wash. And then I needed to open my tap with my elbow, and then I wash my hands. Then I close. If there was tissue, now I pick my tissue, and the way I will pick my tissue, one side will be to wipe this hand, and I place, and the other side I'll wipe this side, and then up to where I'll wash. I'll wash my hands and go like this so that water does not come back to dirty the clean hands that I've already washed. Thank you.
Thank you so much. Can we clap for him? Okay. So our slogan for this year is Unite for Safety, Clean Your Hands. Can we say it together?
Unite for safety, clean your hands.
Unite for safety, clean your hands.
Unite for safety, clean your hands.
Oh Jesus, you're the lily of the valley. Sweet Jesus, you're the bright morning star.